Hi, today we're going to be talking about emetophobia because it's a very common, yet unfortunately very often misunderstood phobia. So we're going to start off by talking about what emetophobia is. Well, it's the fear of vomiting or of being around vomit. And it can even extend to situations where vomiting is even a possibility, such as being sick, being around someone who's contagious or may be sick, and to some, simply walking down the street where vomit may be. Now, what types of things do emetophobics do? Well, the most common thing is that they place very severe dietary restrictions on themselves. They might have a list of foods that they deem are safe, and that's all that they'll eat, and that can result in being severely underweight, which has its own health problems. They might avoid foods that they feel are unclean or are easily contaminated, like chicken or fish, especially. Now, they can even avoid social activities, and that's because in our culture, social activities very often will focus on being around food. And it's very difficult for many emetophobics to eat food that wasn't prepared under their supervision or in their kitchens. So they'll avoid eating at other people's homes or in restaurants where they can't be sure that everything was prepared in a hygienic manner. In that same note, they'll be very obsessive about hygiene and they'll often wash their hands many, many times and disinfect everything around the house and in their kitchen. And this can be sometimes confused with obsessive compulsive disorder, but it's also very prevalent in emetophobia. Some will avoid emetophobia or will avoid pregnancy or having children. And that's for two main reasons. Number one, they fear the nausea and the possibility of morning sickness in early pregnancy. And the second reason is because children and babies and toddlers are usually sick more often than adults, and they'll have more bouts of vomiting, throwing up, and spitting up, and emetophobics want to avoid that. Emetophobics will have very irrational thoughts about what could happen if they did vomit. And an example of that would be an emetophobic that fears if they're with their children in public and they throw up that they'll be distracted and someone will kidnap their children. Now, although that is a possibility, I suppose, it's very rare. It's a very remote possibility. And any sort of distraction could raise that possibility. So it's really the irrationality of the thought and the compulsive nature about it and ruminating on the thought that makes it common in emetophobia. Emetophobics will avoid travel by boat, by plane, sometimes by car. Anything that could cause motion sickness or nausea would be avoided. And this can even stem to medication, even medication that might be necessary for health reasons if it says on the label that nausea is a side effect, which most of them, a lot of them at least, often do. Now, is emetophobia rare? No, it's not, and and that might surprise you. But emetophobia is reported to be in the top five most common phobias, and there's even been some recognized celebrities that have been reported to suffer from emetophobia, such as Matt Lauer and Denise Richards. It's just that emetophobia is usually a very secretive phobia, unfortunately, and it's oftentimes hidden. And like I said earlier, it's not understood, so people feel that it's dirty and they're humiliated by it, which is really a shame because, like I said, it is a very common phobia. So it's not rare at all, and you're by no means alone if you suffer from this. Now, there's a few different treatment options that we have, and inducing vomit is really a bad idea, but it's something that you'll come across very often, which is why I bring it up. And the reason why it's very common is usually stems from inexperienced therapists. And something called systematic desensitization is very common in treating other phobias or anxiety. So, for instance, if you had a fear of heights, you would expose yourself to higher and higher situations until you become desensitized to those feelings and that fear, and you're able to cope with it better, and hopefully eventually your fear of heights would disappear. So, people without experience in treating emetophobia will try to use that same methodology in treating the fear of vomiting. We found that just to be a very bad idea, and it can actually make your emetophobia worse. So we would strongly advise you to avoid any therapist or program that suggests that you induce vomiting as a method of curing your emetophobia. So, when you do seek out a therapist, what we found to be the most successful treatment modality is cognitive behavioral cognitive behavioral therapy. Now, what's difficult with this is finding a therapist that specializes or has a long history in treating emetophobia successfully. Unfortunately, like we had spoken about, because of the secretive nature of emetophobia, very few people actually seek out treatment. So it's very, very rare for a therapist to have any significant amount of history in treating this, which is why probably our most recommended approach would be a self-help approach. We're very fortunate to have some very good programs available for treating emetophobia that you can use in your own home at your own pace that have a very, very high success rate. And probably the most prevalent and most established, respected program for emetophobia is the Emetophobia Eraser program, and that can be found at www.emetophobiaeraser.com. This program was created by Gillian Stevens after successfully conquering her own emetophobia many years ago. And it comes in both audio and written material, so no matter which way you learn best, there's a format that's right for you. And it's really a step-by-step comprehensive method for treating your own emetophobia that we've seen people have a lot of success with. So that's something that we would strongly recommend, especially if you can't find a qualified therapist in your area, or if you can't afford a therapist. Something else to mention is that seeing a therapist one-on-one can be very, very expensive. Self-help programs such as the Emetophobia Eraser program can be had for well under $100, which is really a remarkable value for treating and conquering phobia as debilitating as emetophobia. So to wrap up, if you suffer from emetophobia, the first thing to realize is that you're not alone. It's a very common fear, and it's a very treatable condition. You can find a therapist in your area if you're fortunate enough to have one that specializes in emetophobia, and you're able to afford the cost of that type of approach. Or you can check out emetophobiaeraser.com and see what the self-help program that we recommend is all about. If it's something that you feel would be a good fit for your situation. But have hope. There's many options available for you. People all over the world suffer from emetophobia and are conquering it every day, and you can be one of them too. So thanks for listening. We'll talk to you soon.